Okay, my name's Patrick Vault. This is my Communications 1010 demonstration speech, and what we're going to do is demonstrate adult CPR. According to the Mayo Clinic, they've changed some things now. You start with circulation instead of airway, and you start it by, if you find a victim or you see a victim collapse or whatever, you try to shake them and get them awake, see if you can get any kind of response or check for any kind of breathing to start with. Your second step is to lay them on a flat surface like this is simulated here with a dummy, and just lay them flat, and you got to start with your chest compressions first. Okay, what you do is you find the xiphoid process. It's right here where your ribs come together at the bottom. You come two fingertips up, placing one hand over the other like so, or just like this, placing your hands approximately right here, and do 30 chest compressions. I'll show that in just a minute. After you do your 30 chest compressions, you move to the airway. Now the only bad thing about the airway is that they may get sick in this process, so if you don't have a mask such as this, then a piece of paper or a piece of plastic or something like that, if you feel comfortable with doing it. The way to do this is also according to the Mayo Clinic, is called the head tilt chin lift method. Place one hand here and two under the chin and moving the head back, and what that does is it helps open the airway up. According to how to perform CPR on infants, the biggest thing is trying to do something. So once you get them flat and you've got your mask or whatever, you need to call 911. If you've got somebody else there, have them call. Everybody's pretty much got a cell phone nowadays, so you can call them. And the good thing about calling 911 is a lot of dispatchers are trained in CPR, so if you don't really know what you're doing, they can help guide you through it until ambulance or fire shows up. But anyway, I'll demonstrate real quick. You got them down. Place your hands like so, and you'll do 30 compressions. And then you move to the airway. When you're doing your compressions, the chest needs to go about 1.5 inches to 2 inches down. You may break some ribs or something like that, but that's okay. So move to the airway. I'm not actually going to put my mouth on anything because none of this has been sanitized. But once you do the head tilt chin lift method, you'll blow. You may have to pinch the nose off, and while you're blowing, simultaneously look to make sure that the airway is not obstructed and you're actually getting air into the lungs. Give 2 breaths, and then you move back to your 30 compressions. You want to do this for approximately 2 minutes, and in that time span, get 100 repetitions of the whole thing in a whole minute. So do 30 chest compressions, 2 airway. And if you don't feel comfortable with doing airway, if it's not a family member or somebody that you know, according to how to perform adult CPR, another website, all these are websites, you can do hands-only CPR. So if you only want to do hands-only CPR, just do the 30 chest compressions, see if they're going to breathe or not, 30 chest compressions, same thing, and try to do that for 100 times in a minute. And if it's only 1 or 2 person CPR, if you can't call for whatever reason, go ahead and start doing your CPR first, and then call 911. And that's the conclusion of my demonstration.